Is it possible for mainstream health practitioners to work with indigenous traditional healers? That's what we're going to be looking at today. Across the world, there's a growing recognition of the value of integrating traditional healing practices and conventional medicines, especially in the treatment of complex diseases like cancer. In South Africa, this discussion is becoming more significant. Initiatives like the Pfukani Women's Clinic and the Breast Health Foundation, they're powering efforts to blend indigenous knowledge with modern oncological care, providing holistic support to battling breast cancer patients. Pfukani Women's Clinic, supported by the BHF, empowers women by embracing traditional practices alongside clinical oncology, ensuring that the cultural and emotional needs of patients are met, and BHF being the Breast Health Foundation. Jenna Skews joins us right now, a Chief Operating Officer of the Breast Health Foundation, to speak about the importance of ensuring that cancer care is accessible to a diverse range of communities. Jenna, thank you for joining us here on the show.
Thank you very much for having me.
Let's start with this, because it feels like, what are you guys doing? Indigenous traditional medicines with cancer. Why are you guys doing this? There's not enough evidence. I'm sure that's the kind of initial responses that you get.
100%. And our first point of call is that we are a breast health and breast cancer not-for-profit organization, and we strive to educate on breast health signs and symptoms and then navigate access to treatment. So our war cry is early detection saves lives. If there's a sign or symptom, we would love women to go in and get screened. Okay. We know that within the rural setting, the first point of call is that people go to their traditional healers. We know that that's the first stop. So why not partner? Why not train and work alongside the traditional healers and leaders to say, the community trusts you. We know the community trusts you. We know that you are the first point of call. And if you see these signs and symptoms, this is what we're doing. This is where you can refer patients into. This is why it's important. So a lot of this is starting a conversation with traditional healers and leaders about this is where there is a clinic, for example, the Pfukani Women's Clinic. This is how ladies can access treatment, but then educating on the disease, on the signs and symptoms, why it's so important that someone does go in, get properly screened. We are not saying don't go to your traditional healer. We're not saying stop all the traditional medicine. We're saying come into the clinic, get screening. If it needs to be alongside, then let that happen. Yeah. But if we work together, then there's more of a chance that people can be helped.
Let's expand on that, because, we take for granted how people operate in the communities that we come from. We think that we know what's going on there, and we get to a point whereby we come up with more Western ideas or Western concepts and forget that there's a continent that we live in, which is Africa, and we do things in our own ways here. And traditional healers and traditional leaders are very key in our communities. However, they feel like they're very sidelined, and we don't really acknowledge some of the great work that they do. So for your organization, how did you come to that recognition to see the pivotal role that traditional leaders and traditional medicines plays?
So I completely agree with you, and we've seen this recently. So we work a lot within Mpumalanga, within the Tinswalo Hospital, and in that area, in the Pfukani Women's Clinic. And as the not-for-profit involved, what we provide is a patient navigator, who's someone that will counsel ladies, navigate them to access to care, but then we also provide training, and that can be for doctors, for nurses, for primary healthcare givers, And we have now included traditional healers, okay? Because we feel that specifically in these rural settings, the traditional healers are the most important, and as I've said, the first point of call. So recently we've had a week of training, and in this week of training we included traditional healers within this training, and they had a day's training on cervical and breast screening, that kind of a thing. And we saw that in the beginning they were very hesitant. And we've seen that there is tensions between Western medicine, between the doctors and the nurses and the traditional healers. We have an absolutely wonderful facilitator, Dr. Manila Makua, who is from the area herself, understands the local community, and was able to say, I see you, traditional healers. We are here. This is our information. And able to give the traditional healers a day's training on cervical and breast cancer. And we saw at the end of the day, the traditional healers were so grateful for the knowledge. They were so grateful that we said, hey, let's start the conversation. We're here. Let's facilitate a conversation, let's facilitate training. And that was the important thing, is that we were able to say, we're here. Yeah. We don't have any bias, any prejudice. We understand your point in the community. We know you are respected, and this is what we know about the disease. How can we work together?
Yeah, that's so powerful. And how did you break that hesitancy? That's an interesting one, because at times, you come into a community and you think you are the answer to the community, and then the community is like, no. We've got our own systems. How did you break that wall?
So a few things, and our head office is in Joburg, and we by no means want to go into a community and put our thoughts into that community. We want to help that community in best way we can. Yeah. And there's a few things that we've done that. So our navigator that we have at Tinswalo is from the community herself. So she's understands the community. Then in addition to that, what I think is so important is the specific trainer that we got for this. It was Dr. Manila Makua, and alongside her was Prof. Tulani Makua. Both of them know the region. The training was given in the language, in the vernac, nothing was pushed on to the traditional healers. It was going, hey, we see you. This is our information. And that seemed to have really put the traditional healers, kind of calmed them down, and made them open to go, we want to share our knowledge. And at the end of the training, it was really a beautiful day. And for us as Breast Health Foundation, as outsiders, to be accepted, and for the traditional healers to go, hey, we love this knowledge. Yeah. And we even planning further trainings to go back and do more training with them to keep that relationship going, was a very special day that they, at the end of it, embraced and said, this was so interesting. We learned so much. Yeah. Thank you for this. They realized that we were not there to push Western medicine. We were not there to say your way is wrong. We were there to go, this is our knowledge. How can we help each other?
Right, Jenna, that's so powerful. I like the fact that also the training was done in the people's languages. That's such a powerful thing that you could take for granted. You could think it's just a micro element, and you kind of absolve the people's being. But if you include their language, you actually make it, you localize the problem, number one. You localize the issue. But more importantly, you also make those that community affirmed in who they are, not because you're there, but because you consider their context. Well, we're speaking to Jenna Skews, Chief Operating Officer at the Breast Health Foundation, talking about cancer care accessibility, but not just looking at it from a Western perspective, but how do you also include traditional healers, traditional medicines as part of that healing journey?
Benjamin Moshatama and Palesa Tau on the move.
I think the conversation we're having highlights the power of raising awareness in a way that is local and in a way that fits the concept and, of that particular community where the awareness is going. And we're seeing that in this initiative with Pfukani Women's Clinic as well as the Breast Health Foundation that are pioneering efforts to blend indigenous knowledge with modern oncological care, providing awareness, providing education to traditional healers in this community that allows breast cancer patients to really understand the concept of their health from both perspectives. We're still chatting to Jenna Skews, Chief Operating Officer of the Breast Health Foundation, who's joining us on the line to speak about this initiative and the importance of ensuring that cancer care is accessible to a diverse range of communities. Jenna, thank you so much for staying with us. Let's speak about the education itself. I have seen a situation, in fact, one of my mother's friends who was really, really ill. It's not cancer that she has. I'm not sure what she had. Unfortunately, she's passed on. But in the later years or later few years of her life, she stopped going to her traditional doctors, the clinic, and, getting the medicine that used to keep her well. Instead, she went to a traditional healer who, rather than telling her to, continuously, seek traditional care, but also modern care, they allowed her to get to a place where, unfortunately, she ends up passing away. And those are some of the concepts that we have to avoid in our communities, where traditional healers don't have the awareness and the education to also work together with modern medicine in the care of the people in their communities.
Hi, Palesa. Thank you so much. Absolutely. As the Breast Health Foundation, we've seen many patients present either very late with breast cancer, where the disease has spread because their first point of call was their traditional healer, or patients starting in Western medicine and then stopping and going to their traditional healers. And what we're saying is that there's a place for everything, and we would rather work alongside each other and make sure that we respect the work of the traditional healers and that they have knowledge of when it's necessary to refer into Western medicine.
So how have you made sure that patients can trust both, the systems that are being fostered, both the traditional medicine, oncological, modern medicine as well, without, putting down one concept or the other, but also making sure that whatever consultation process they take, whether it's, through the traditional healer first and then the modern medicine, both can work in conjunction for the care of these patients?
Well, I think the start of this is that we have started this conversation with the traditional healers. And the traditional healers at the end of it said, now we know when we need to refer in. Now we know when patients are symptomatic. And I think being able to respect each other and for us to as Western medicine practitioners to not say, no, don't ever go to your traditional healer, and for the traditional healers to go, this needs to be referred in, go to this clinic, get screening. The fact that when we can respect each other and that when a community member trusts their traditional healer, they go to their traditional healer and their healer says, this is symptomatic of a breast or a cervical cancer and refers them in. I think that in itself builds trust within the community of both the traditional healer and the Western medicine. The fact that we are working alongside each other and that when necessary the healer is referring in and that us as Westerners are not going, no, you're not allowed to see the healers. That respect and training across the two paths, I think, build the trust for the patients and the community members.
What are some of the tangible differences in communication and seeking medical care have you seen within the community that you've worked with the Pfukani Women's Clinic in this integration of indigenous practices and modern practices?
So the Pfukani Women's Clinic was established because one of our corporate partners, the Discovery Fund, was involved with the Hlukumele Clinic, which was a clinic in the area, and they had said, we have women presenting, we need help, we have all of these women presenting that need access to treatment. And so we began the development, and in conjunction with Mpumalanga Department of Health and Tinswalo Hospital, we were able to help facilitate the Pfukani Women's Clinic. So we know that there is a need within the area. What we are seeing is that women are presenting late. Women are coming in when the disease has progressed, and they're not coming in early enough to be able to manage the treatment and to get to a point of no cancer. And that's our aim, is early detection and to get women into the healthcare system as early as possible. Now, we've trained and begun this relationship with traditional healers because we know in that area, people's first point of call are traditional healers. So we're not wanting to work against any systems. We're coming in and we're going, hey, how can we help you? We know that communities trust traditional healers. So let's train traditional healers on what signs or symptoms are, where the clinic is, how we can refer patients, and how we can hopefully get patients coming in earlier so that they can get access to care and get to a point of no cancer and not get to a point where they pass because their disease has progressed.
Well, we'll have to leave it there, Jenna. Thank you so much. I think more than anything, this highlights a huge respect to the beliefs of the people in those communities, making them affirmed in the fact that your beliefs are valid, but we want to work with you to make sure that you are well at the end of the day. So thank you so much for unpacking this initiative and concept with us.
Thank you very much.
That's Chief Operating Officer at the Breast Health Foundation, Jenna Skews, giving us an understanding of cancer care, the accessibility and merging traditional healing medicines and practices with modern medicine for cancer care.